Hello, everyone. I'm at a location today. I'm actually in my car on the way to the airport, but I did not want to miss out on this live today because we had some technical issues last week. And so I know we had to cut it a little short. So I'm going to have some barking that's going to interrupt the live in just a moment. Just so you know, we have a dog who is pregnant. And so she has to go to a special sitter while we leave to be able to watch and make sure she's okay while we're gone. So we have to drop her off on the way to the airport. So she'll be barking. I apologize right now ahead of time. Happy to be here. And we had you submit some questions. Nice, because I'm going to be able to hit the ground running and just get right to these questions right off the bat. So let's get them started. First of all, how do I get rid of thrush? I tried antibiotics and now fixing my gut. Do ozone products help? Well, this is a really interesting question because thrush is actually fungal. So if you use an antibiotic when you have a fungal infection, it will make the fungal infection worse. Why does this happen? Because antibiotics and yeasts are actually at their opposition to one another. So an antibiotic kills off all the bacteria. Well, if you kill off all the bacteria, there's no opposition for the fungus anymore. So now you are going to have fungal overgrowth and crazy fungus growth. So an antibiotic is the wrong thing to use when having a fungal infection. You want to use an antifungal. One of the very best antifungals is colloidal silver or coconut oil. So those are the two things that you can use when having a thrush infection. Ozone does work as well. So ozone is great, just tastes nasty. You really want something you can swish with. So that's why my mouth rinse is phenomenal for this. It has colloidal silver plus some other herbals that are going to work as an antimicrobial, as an antifungal. But coconut oil also works very well as also. So you can swish with coconut oil. Do oil swishing. Oil pulling is another word for that. All right, thoughts on turbinate reduction procedure and other options? This is a really good question. So what the turbinates are actually, they're kind of little curly Q things that go up through your nose. And the reason that we have curly Qs in the nose is because as the air passes through those nasal passages, we wanted to do a couple of things. First of all, we wanted to get filtered. So those turbinates help to filter and pull out all the junk. That's what I joke with kids and say, that's what your snot is. It's basically the stuff in the air that we breathe in that we don't actually want to get into our lungs. So the turbinates are super useful. They're going to filter the air. They're going to warm the air slightly so that we have warm air hitting our lungs. You know, when you're outside and you are breathing really cold air, it kind of hurts your lungs. Well, the turbinates help you to warm that air. They also help you to moisten the air, to humidify it slightly, which is also better for our lungs. So the turbinates are really important. If you can't breathe through your nose, then turbinate reduction surgery is one thing that has been proposed or that you can do. What that means is you're just going to open up the space in there. You're going to decrease the size of the bony projections inside the nose. Now, this could be good and it could be bad. It could be good because it can make more space. It can be bad because, like we said, turbinates actually have a really good purpose. So that may be your only option. However, there is another option that I talk to people about all the time. The floor of the nose, so the bottom of the nose, is actually the same bone as the roof of your mouth. Same bone. So if you have a very narrow mouth, a very narrow palate, roof of your mouth, you also have a very narrow nose, which means you have very narrow turbinates. So ideally what we're going to do is actually expand the roof of your mouth, expand the palate, so that you can also expand the floor of the nose and get more space. That's my preferred first step, is let's do some expansion. If that's not enough, then we can move to a turbinate reduction surgery. And it may be that you're going to need both, but that's a very good question. How do we expand the roof of the mouth? We can do it with a couple of different things, depending on the size of your mouth. We can use an appliance called Vivos. That's the brand of the appliance, and it gets us the most effect, the most expansion, but you have to be able to wear it about 16 hours a day. You can't talk very great with it, and you can't eat with it. So that's not always an option for people. So another option is clear aligners like Invisalign, where you can't get as much expansion with that, but it does help some. So those are the two options for you. Is using your mouthwash equivalent to oil pulling? Well, it's not exactly equivalent because we're not doing the same thing. Oil pulling is pulling bacteria from all the nooks and crannies, but the mouthwash will do the same. It's not going to pull them, but it's going to balance them. So you can substitute. In fact, I don't do oil pulling. I use the mouthwash instead. Let's grab one from over here. Does chewing on ice hurt your teeth? Well, yes, because ice is hard, so it can damage the teeth. Interesting thing is if you have a real need to chew ice, It's actually a sign of mineral deficiency. So once your minerals are regulated and balanced and you have enough, you typically don't want to chew ice anymore. So it's kind of an interesting little known fact there. Root canal on one front tooth. The dentist wants to crown all 4 front teeth to color match. Is this smart? So the question is, if you have a root canal on one front tooth and it looks bad, if it doesn't look right, the dentist wants to put crowns on all of the teeth to make sure that the color is right. Well, this is actually a very common thing in dentistry where it's difficult, extremely difficult to match one front tooth. In fact, I have a crown right here on an implant on that tooth, and it matches beautifully. But it took us a couple tries to get that. I have a veneer on this tooth because it was a little teeny tiny tooth. Matches beautifully, but it took us a couple times to do that. It's actually hard to do. It's not impossible. So you can do just one front tooth. I wouldn't recommend doing all 4, and I certainly wouldn't recommend crowns because crowns take away a lot of tooth structure to make room for the porcelain material. So instead, I would recommend veneers. Again, your situation may be different. You may have a bunch of fillings up there. I don't know your situation, but I typically like to do 2 for color matching. One front tooth that has the root canal, and then the other one as a veneer just to cover it over and make sure it matches. How long will it take the surface cavities to be removed with your remineralized tooth powder? Okay, this is a good question too. So basically they're asking, will the cavity go away if we remineralize it with the powder? The cavity doesn't go away, but the tooth is remineralized, meaning there may still be a spot that shows up on an X-ray. However, it never grows, never gets bigger because the defect is filled in with new minerals. So you may still see it. We tell people all the time that if you're remineralizing and if we found that cavity is not getting bigger, that's the key. If you go to a new dentist, they say, oh, you have a cavity here. Say, I've had that for 8 years. That's actually a remineralized spot. Typically, it takes about 3 to 6 months, depending on your mineral load in your body, how much you're feeding your body minerals as well. Can a cracked tooth be sealed back together on its own? I know the tooth powder can't regrow teeth, but can it bind a cracked tooth? All right, so this question is all about cracks, and the answer is all about depth of the crack. So if the crack goes all the way into the nerve of the tooth, no, there's no way that's going to be repaired with anything remineralizing. It most likely is going to have to be removed if it's cracked all the way through into the nerve of the tooth. If it's a crack on the side of the tooth, if it's something we call Xrays lines, which is kind of like a porcelain plate that you get just tiny little cracks in, it doesn't crack the plate all the way through, but you can see these kind of little cracks in the glazing. Those Xrays lines can be reinforced and strengthened with remineralizing powder. So it all depends on the size of the crack. What are your thoughts on human bone grafts for previously infected root canals? So if you have a previously infected root canal, I'm going to recommend most moving the tooth. If that next step is, how do we rebuild that area? And the first step is to rebuild the bone. So step number 1, rebuild the bone in the area. How can that be done? It can be done with a few different things. We can do a human, there goes the dog. She didn't even bark. Good dog. So it can be done with human cadaver bone. We do use that sometimes. It can also be done with synthetic bone. So either of those are options for doing a bone graft. If you have mercury fillings and want them removed, are composite fillings safer? Yes, that is the replacement material of choice for a small filling. So if you have a mercury filling, it's going to be removed. We do recommend replacing that either with composite if it's a small filling, or with porcelain as a porcelain onlay if it's larger. So those are the 2 options that you're going to be looking at for replacement of an old mercury filling. All right. Can you use braces to expand young teens' mouths to improve sleep? He snores and grinds his teeth. Absolutely, you can use braces for this. In fact, this is one of the very best uses for braces, is to expand that mouth, make more room for the tongue so the tongue can come forward and out of the airway. This is awesome in teens and kids because they're still very malleable. Things are able to be changed, which is great. It's a little more difficult in adults, but it still can be possible. We still can do it. But this is one of our very first things that we do if there are sleep issues in any age, is to expand the mouth, make more room for the tongue. Favorite toddler vitamins or probiotics for teeth? I love Llama Naturals. So if you've never tried Llama Naturals, it's kind of fun. My grandbaby, she comes to my house, she opens up my cupboard and she pulls them out. We have like 4 different varieties. She pulls them all out on the cupboard. We open one up, we give her one, we open one up. She says, vitamins. She loves her vitamins. They're the Llama Naturals. They're super tasty. I, in fact, eat them along with her because they're quite tasty for adults too. Anybody can eat them. They are by far my favorite. Favorite trace minerals to remineralize toddler teeth. So there is a mineral supplement, but it's not super tasty. It's called concentrates. So you're going to add that to something like an applesauce that tastes a little tastier, tastes a little bit better. So concentrates is a good way to do that. You're going to add it to something else. How often do I need to get mouth x-rays done? Do I really need them every year? Thank you. It depends on what your history is. If you have a history of a lot of tooth decay, a lot of cavities, a lot of gum disease, a lot of anything, then yes, we need to check every single year, because if you have a cavity start and it's been 2 years since we took an x-ray, that cavity can already be quite deep in the tooth and even threatening the life of that tooth by the time 2 years has passed. So it's all dependent on your teeth. Now, I had a cavity maybe once when I was a teenager, and I've never had one since. So do I need x-rays every year? No, because I just don't get cavities. I just don't have that as an issue. So I do them. I check periodically. I check for gum disease on an x-ray. I check for tooth decay. So I think you can go every 2 to 3 years. 3 years is my max I would ever go if you do not have a history of either tooth decay or gum disease. Those are the main things that you need to be watching for. Do remastered sleep water bottles actually help with mouth breathing? I don't even know what a remastered sleep water bottle is. So apparently I need to do some research into that one. I will let you know. I see your tooth powder on Amazon. Is it okay to order there? Yes, that is our store selling on Amazon. We're trying to make it more accessible for you and better shipping, all those kinds of things. So yes, when you see it on Amazon, that is us selling it on Amazon. We're working on getting our store up and going so you can tell it's us on there. When is toothpaste coming? Paste for kiddos. I just this morning sent an email to the manufacturer, and I met on Monday with a new manufacturer that's going to be helping us with, excuse me, can't talk, with a toothpaste formulation. Unfortunately, it never happens quickly. So I think it's going to be at least 3 months before we're going to get that. But we're going to be making some wonderful flavors, and you are going to love this because it is multifunctional. It's not only all the things that the tooth powder does, but we've added a few other benefits to it as well. So coming soon, information coming soon on that. Does nanohydroxyapetite cross the placenta and blood-brain barrier? Are there risks? So there's a lot of talk about this, a lot of talk and research going on about this nanohydroxyapetite issue. The issue is the size. Everything is based on size when we're talking about crossing the placenta or the blood-brain barrier. So the key is you want to get something larger than 100 nanometers. That's the key. That's what you're going to ask about. Everything, the nanohydroxyapetite is defined as 100 nanometers or smaller. And research is showing that if it is in that small of a size, it can cross that blood-brain barrier and the placenta. So you want something larger than 100 nanometers. The hydroxyapetite that we use in our tooth powder and mouth rinse is a 200 nanometer hydroxyapetite. So it is larger and it does not cross those two barriers. PRF versus bone grafting in the jaw. Which one do you want to do? Well, we do both, and we do them together. So when you're doing, when you have a tooth removal, when you need bone regenerated because you're wanting an implant placed or something in the future, we do need bone to be able to put an implant into. And the best way I have to describe this is think about a screw in wood. When you have a screw, you simply cannot put a screw that's only half in the wood. It will never stay, right? It makes sense to us in that regard, but we don't think about that in the mouth sense. Well, you have to have bone on either side, on all sides of the implant, to be able to allow it to be firm in the jawbone. So when we're doing bone replacement and bone regeneration to be able to place an implant in the future, we will add bone particulates, either cadaver bone or synthetic bone, mixed with PRF, which is your own stem cells, growth factors, things from your blood. What that does is it allows the body to recognize whatever we put in there and go, okay, I know what this is, and I know what I'm supposed to do with it. I'm supposed to grow bone here. So we use them both together. Can you stick with just herbal protocols instead of antibiotics after cavitation treatment? Well, this is a good question as well. When we're doing cavitation treatment, or what that even means is it's an area of the jawbone that didn't heal right, when we typically find a lot of bugs in there. So we're stirring things up when we're going in, cleaning them out. We're stirring things up, and it could spread those bacteria and viruses and whatever else is living in there. It could spread them a little further than just where they have been. We're obviously taking away the source, which enables the body to heal. However, it may have an increase in all of those bugs during the healing process. This is why we recommend antibiotic therapy. Now, there are a lot of herbal antibiotics and herbal antivirals. We typically do an IV antibiotic Why? Because we want the antibiotic into the system, but you have to do it a few times. You have to do it 3 or 4 times after to be able to get enough antibiotic dosage. It doesn't go through the gut that way, which is what a lot of people prefer, which is the reason we do it. So we do it that way. You can take herbal products. Just know that you're, just taking that in your own hands and saying, okay, am I willing to risk that I may get an increased infection from this because I'm not using a, regular antibiotic? How long before my 5-year-old son's cavity turns beyond the point of repair? So a cavity is beyond, quote unquote, the point of repair when it gets through the enamel and into the dentin layer. A tooth is made of basically in essence, 3 layers. There's the enamel that you see on the outside. There's the dentin, that's the next layer in. And then there's the pulp, which is the nerve, the blood vessel, all of those things on the very inside of the tooth. So when the enamel is made of a lot of minerals. When you have a hole in the enamel, which is what a cavity is to begin with, then you can remineralize by putting hydroxyapetite back on the tooth in the form of tooth powder, in the form of the mouthwash. Once the cavity has progressed into the dentin, there's all sorts of little tubes going through that dentin everywhere, which means those bacteria that are in that cavity have basically jumped on those superhighways inside of that tooth and spread. So once the cavity is into the dentin, that's when you're going to have a dentist fix it. Interesting thing is, on kiddos' teeth, the enamel is very thin. So cavities progress to the need of being repaired very, very quickly because the enamel is very thin and it gets to the dentin quickly. My husband constantly gets cold sores in his mouth. What can he do to prevent them? So if it's a true cold sore, then that is viral, and that is something that is usually stress-induced. If it's a canker sore, which is a different thing entirely, it's a different mechanism. So cold sore is viral. And it usually is induced by stress, which is sometimes the sunshine, sometimes biting on your cheek, sometimes just stress. A lot of getting sick sometimes will initiate that. If it's a cold sore, or excuse me, if it's a canker sore, it's also often due to stress, but it's more like trauma to the mouth. So it's something that your body is allergic to. It's creating a reaction to it and leading to a canker sore. If you bite your cheek, it'll do that. It'll lead to an ulcer. Sometimes it's immune function based. So I believe cold sores are viral. Canker sores are immune system. If you're getting a lot of canker sores, you're going to want to help strengthen the immune system. What do? There's a lot of immune modulators, a lot of immune modulator herbs like oregano, garlic. These are all things that are going to give your immune system a lot of strength. So try those. Don't put oregano oil in your mouth because it will burn like crazy. So don't try that one. But you can take oregano oil capsules. That's a great way to do it. We just took a wrong turn, I just see, and we're right by one of my very favorite restaurants. Unfortunately, we don't have time to stop. It's a phenomenal Korean restaurant right over here in West Valley, Utah. But we are doing a little U-turn because we did not get on the freeway like we were supposed to. Unfortunately, I wish I could go to the Korean restaurant for a little breakfast, but we won't. Okay, sorry. Side note: all the stainless steel caps for kids for cavities harmful. Stainless steel is a different type of metal than mercury. If your child needs a crown or there's a lot of tooth that's been lost, it's going to need something stronger that's going to get it through the next few years. We do zirconia crowns on kids even, but they're expensive. And they're a little harder to use, honestly. There's some pediatric dentists that refuse to use them. So stainless steel crowns are the go-to. They're the things that are done routinely. We don't do them in our office, like I said, but they are done routinely, and it is quite an inert metal. It's the metal that's used in braces, so it can be in the mouth without nearly the effect of mercury. Now, does it still conduct electricity? All of those things, it does. And typically, if a tooth has progressed to the point of needing a stainless steel crown, it's in pretty rough shape. So I have you watch them very, very closely. Look for a little pimple or a boil on the tooth or on the gum below the tooth. That means the tooth needs to go away. Tooth needs to be removed at that point. So I don't love them. We do zirconia, but if it's the only choice, it's an option to keep the tooth in the mouth for a little while. Is it okay after removing a root canal tooth and applying ozone therapy to immediately add bone graft? Yes, that is what we do. We remove the tooth, we ozone it, and then we do bone graft with a PRF right there at that time. Do you have connection to oral? We have a lot of oral surgeons in our network that we refer to, so go ahead and give us a call about that one. Hey, we got a gardening question. I love it. Can you germinate seeds in a pot? Absolutely. So all it takes to germinate seeds is it just needs to be under the soil. Usually there's some seeds that actually need sunshine, but most of them need to be under the soil. They need to stay wet all the time until they sprout. That is one key for germinating seeds that people don't often realize. You cannot let that soil dry out until that seed sprouts. So that is key number one. Once the seed is sprouted, you can go to watering every 2 days for a little while until it's really rooted, and then sometimes you'll even go to every 3 days. But until it sprouts, it has to be watered all the time. You also need about 16 hours of light a day. So if you don't have 16 hours of light a day where you are, then you may need to supplement the light. Why is it more difficult to floss one molar than the same on the other side? That's a great question. Most likely in your mouth there may be a filling on that molar that's difficult to floss, or a crown, or something that makes it difficult to get around. It also may be that's just a little tighter over there because of the way your teeth came in. So probably just the tooth situation itself. Is the mouth connected to hormonal health? Hugely connected to hormonal health, especially areas where wisdom teeth were and your very back molars. Those are very related to hormonal health. If we want to talk that, so estrogen, progesterone, testosterone, all of those things. A lot of fertility is related to those wisdom tooth areas. When we're talking liver, gallbladder, those kinds of things, they are all front teeth here. Stomach, small intestine, spleen is here. Lungs down on the bottom. These are all the connection points of everything in the body. But hormones are back here, wisdom tooth areas. If your spouse has gum disease, can you get it? How? Through the saliva? So this is a great question. People don't understand this very well. Gum disease is a bacterial disease that is absolutely transmissible. So you get it through saliva. You can pass it on to a child through sharing a straw, sharing a drink, sharing a fork. This is why we see kiddos with cavities. Cavities is a transmissible disease as well. Cavities and gum disease are both bacterial based. So you can transmit them, you can give them to other people, which is kind of crazy, but you can. You can give the bugs that cause tooth decay and gum disease to other people, and it is through the saliva because it's just bacteria. Do you think tea or coffee in the morning, if you drink tea or coffee in the morning, should you brush before or after? Asking because of the acidity. Great question. So there is, tea and coffee both are slightly acidic. They are more acidic. The problem with acidity is it's going to soften your tooth enamel. So if you drink a lot of tea and coffee in the morning and then you brush your teeth are actually going to be more prone to abrasion, which means you're going to brush the tooth away a little bit. So if you do not want to brush your tooth away, actually brush before tea or coffee. But if you want to brush the tea or coffee off of the teeth, then what you're going to do is brush after, but after 30 minutes. So wait 30 minutes before you brush after. Can your kids get gum disease if they use your straw or drink out of your cup? Yes, kids can get gum disease. Like I said, bacterial disease is infectious and transmissible. You can transmit gum disease as well as cavities to kids if they drink out of your same straw or cup, if you have gum disease or cavities yourself. My 7-year-old son and I use your tooth powder and daily rinse. We love it. He has his dentist appointment next week, and I'm eager to see what she says about his teeth. Awesome. We get so many good reports of people saying, holy cow, what have you been doing? Like, you have no cavities. Your gums look awesome. They look better than they've looked in years. What have you been doing? I love it. Share your stories, please. We want to hear them. Thoughts on apicoectomy instead of redoing a root canal? I can't afford removal or an implant. All right, this is a challenge. So what an apicoectomy is let's say I have a root canal on this front tooth right here, and it has a new abscess at the end of it, which is simply where there's always dead tissue inside of the tooth. Bacteria have found it, they've spread, and they've started eating away the bone at the end of the root. Every time you bite on that tooth, you've also spread that bacteria all the way through your body too. So this is a big deal. What an apicoectomy is they go up, and instead of just redoing the root canal the way that they usually do a root canal through the center of the tooth, they instead go up, cut the end of the root off. So it's a surgical root canal, cut the end of the root off, and then fill it from the top down. Now, this is a procedure that can buy you some time for the tooth. It can help the tooth to last a little while longer. However, I'm going to challenge a little bit you saying, I can't afford removal or an implant. Well, actually, removal is much less expensive than an apicoectomy, or at least similar. It may be that you do removal and then you don't replace with an implant right now. You replace with something else, with a retainer that has a tooth in it. Now, I know if it's your front tooth, that's not the most desirable situation. I get it 100%. But just know that most likely with an apicoectomy, you're also going to be looking at a removal and an implant somewhere in the future too. So perhaps you can just space out treatment rather than having to redo treatment. Because if you do a retreat, if you do an apicoectomy, you're probably going to be doing a removal and an implant somewhere in your future. Okay, we have just a few more minutes. I might as well hit some questions that we had from last week that we didn't get to. I have an amalgam filling that is cracking my tooth. My biologic dentist wants to replace the amalgam and crown it. I'm good with that, but I'm breastfeeding right now. Do we wait to address the amalgam? Yes. We wait to remove mercury until breastfeeding is done. Why? Because you're going to release a lot of mercury and it is going to get into the breast milk. So I recommend waiting until after breastfeeding for mercury removal. Do you have to replace a removed tooth? I had a tooth removed due to a faulty filling and don't want to go to a root canal route, but also don't want to have a tooth replaced. Is that okay? Yes, it is okay. Just to leave the tooth out. That's an absolutely viable option. You know, I always joke that if it's your front tooth, that's probably not a very good option for you. That your IQ drops 50 points the moment that a front tooth comes out, just from, look standpoint. But we have a lot of patients who lose very back teeth and they don't replace them. They choose not to. I have a medicating filling done instead of a root canal. If my filling is infected with decay, what can I do instead of a root canal? If the nerve of the tooth has already been accessed, meaning if the filling has gone to the nerve of the tooth and they've already gotten into the nerve chamber and addressed the nerve, which if you have a medicated filling, that sounds like that may be the case. If the nerve is already involved, there's only two options. Whoop, sorry, very, very rocky right here. There's only two options if the nerve has already been involved. One is a root canal. The second is remove and replace the tooth. So you really only have that choice if you have already accessed the nerve. So that's the question. Is the nerve already accessed? Is the tooth already dead? If that's the case, it's removal or a root canal. Only choices. How do I know if my dentist is assessing my bite properly? That's a loaded question. It's kind of interesting. Back in, probably the early 2000s, we called them bite wars. There were wars going on inside of dentistry about what kind of things we should do to get bites right. Lots of people were looking at the jaw joint itself. Others were looking at the muscles in the jaw joint. I mean, literally, there were wars going on about this. So every dentist may be a little different in doing this. The key is, how does it feel? How does it feel? Do you feel like everything's balanced? When you're just driving along, do you feel like, oh, yeah, rough estimate money-wise for undoing a root canal? It's really based on which tooth it is. What are you going to do to redo, an implant, bone grafting, all those kinds of things. But you're looking probably in the $5,000 to $6,000 range. It's not cheap, unfortunately. I wish it were. I wish that we had another way to do it. But typically, because you have to remove the tooth, which is going to be a dollar amount, you have to replace it with a dental implant, which also may include bone grafting, which are going to be $2 additional amounts, and then you have to do a crown on top of the implant once it's done. So but you can space those things out, so you can spread them over a couple of years if need be. But that's ballpark for what you're looking at. Best device for sleep apnea. Well, this again is another loaded question, because I actually don't recommend a device for sleep apnea. I recommend finding root cause for sleep apnea. So we say, okay, what is causing this? Is it because you have infection in the mouth? Is it because your airway is being crowded out because of your tongue that doesn't fit in your mouth? Is it because you can't breathe through your nose? What is the underlying issue that's causing it? That is the thing that we need to deal with first. And then we decide, is appliance therapy best, or is there something else that should happen? Can we get rid of infection? Can we shrink up the tissue at the back of the throat? Can we make your mouth bigger so your tongue has room? All of these things are things we look at. I need to remove many of my teeth. Do you recommend dentures or implants? If you can do dental implants, 1000% you're going to be happier with dental implants than dentures. Dentures never replicate your chewing ability. So you're going to lose about 75% of chewing ability when you go to a denture. A dental implant is going to replace your chewing ability 100%. So this one's a dental implant on me. I don't even know that I have it, other than I show people all the time. But you're going to be able to chew again with implants. Dentures, you do chew, but it's very altered, and you can't chew a lot of the same foods that you like. What are my thoughts on xylitol baby tooth wipes? This was last week, and I remember I answered and said I've never really heard of them before. The thought of them, I suppose, is that xylitol does not promote cavities, meaning xylitol won't cause a cavity. So I'm guessing you're wiping the teeth with it to make sure that they don't get cavities. My take on that is, go ahead. I can't see any harm in it, but then use tooth powder too and put minerals back in. What is a root canal removal? What exactly is a root canal? Great question. Let's talk about this. So a root canal is when a tooth has a cavity that's gone to the nerve of the tooth, or a break that's gone to the nerve of the tooth. There's the nerve that's the center portion of the tooth. So once the nerve is affected, the nerve dies, and that blood vessel, nerve tissue inside of that canal, so it's the inside canal of the tooth, literally becomes necrotic or dead. That has to be removed. So they remove the nerve tissue and blood vessel tissue on the inside of the tooth, clean it, then fill it up with kind of like a plastic material. It's called gutta percha. Well, it works for a while because the tooth is still there. You're still able to chew with it, and that seals it. Unfortunately, there's not just one canal inside of a tooth. There's literally a mile of tubules inside of every single tooth. And those little tiny tubules cannot be cleaned and they cannot be filled. So they still have dead tissue in it. This is why we don't take your gallbladder out when you're having a problem, then clean it all up and then shove it back in, because your body doesn't deal with dead tissue. Bacteria always find it. Never doubt that they will find it. So they're going to find that dead tissue inside of the root canal tooth. Your immune system is really compromised, having to deal with it, has to deal with the infection, has to try to tamp it down all the time and not let it spread. Eventually the bacteria win, and they start to destroy bone all the way around the end of the root. And that's what, this is another question saying, well, why do old root canals form abscesses underneath? This is the why. Because there are still little tubes with dead tissue in them that attract bacteria. The bacteria spread and eat away the bone. That's what happens. That's why they fail. So a root canal is the filling material inside of the root canal. Unfortunately, they can't fill or clean all of the root canals, and so bacteria usually find the dead tissue and will reinfect the tooth. This is what we see day in and day out in our practice. So when you're doing a root canal removal, what you're doing is you're just removing the tooth that has had a root canal. So a lot of times people will say things like, well, I don't have a tooth, I had a root canal. You still have the tooth's still there. All they did was clean out the center portion of the tooth and fill it in with a plastic-like material. You still have your tooth. So when we're removing a root canal, what we're removing is the tooth that has a root canal. So the verbiage is a little off there. We're removing the tooth that has the root canal completely so that we can rebuild the bone and replace that tooth with a dental implant. All right, I think we are on our last question here because I'm getting to the parking, so this is perfect timing. What are healthy root canal alternatives when recommending to get a root canal? Well, the first thing I always say is the tooth still alive? If the tooth is still alive, we can save it, usually with ozone and with killing all the bacteria in the deepest portion and not uncovering the nerve. That's our first and only option to save a tooth from a root canal. If a tooth is already dead, the only option is to remove and replace it. So the key is the tooth still alive? That's the question. Is the tooth still alive? If it is, we do everything we can, and we're about 95% successful at saving them. If it's not still alive, root canal or removal is your only option. Thank you all. Please follow along. I'm heading to Ireland. If you didn't see my story, I actually was a foreign exchange student in Ireland 34 years ago. I did the math, almost 34 years ago. And I stayed with the family there. I would go to school all week long, and then we would travel the country all weekend. And I have not been back. I'm so excited. And I'm going to be doing a lot of research for my book while I'm there, really learning about nature and all the things that nature has to teach us and how nature heals us. So follow along. There's going to be all sorts of cool stuff, and you can come on my trip with me. Thank you all. Thanks for always showing up for these lives. I love teaching you.